All right, you've given us a bit of an idea of how you start your day brushing and then moving into a more protein-focused meal, maybe brushing again once you get to the office. But let's go through your daily oral care routine, starting from the top when you wake up in the morning, and then we can stop at different points, talk about different products, why you're choosing them, why you're avoiding certain things. And I think we can get a lot out of that.
Yeah, absolutely. So this is what I do. I like to oil pull a couple or a few times a week, 2 or 3 times a week. I use raw organic coconut oil. I don't do it every day because coconut oil is antimicrobial. And so I don't like putting, even though it's natural, I don't like putting antimicrobials into my mouth every day. So that's why I like to oil pull, but I'm just cautious that I don't overdo it. So when I wake up, sometimes I'll throw some coconut oil in my mouth as I'm like walking around, tidying up my bedroom or laying out my clothes. I do it for a few minutes and then I spit it out into the trash can. I then usually move right into flossing and brushing. Now, I don't think everyone needs to floss in the morning. I like to set realistic expectations for people, but you have to remember I'm a dentist. So to me, I want to floss my teeth. It just feels good because there may be a light biofilm on my teeth from sleep. Okay. So, and then I brush and then I go on with my day. I go eat and I drink my black coffee. I usually will have some lemon water later in the morning. I tend to either drink it with a straw or I just swallow it quickly because, a lot of people get nervous. My dentist said I need to stop the lemon water. You don't want to drink it and then hold it in your mouth. Like you don't want to hold it against your teeth because it is acidic in the mouth. So I just kind of quickly swallow it, rinse with water after. And then I don't eat anything again until lunch because I'm usually very satisfied from my high protein breakfast. I also tend to brush again mid-afternoon before I see patients. I don't do it right after lunch, but I will sometimes floss and brush midday. Again, I don't expect most people to do this. I'm just saying what I do. But you could throw in a piece of xylitol gum while you're out and about or something like that after your lunch. I actually would recommend that, or certainly swishing and rinsing with water. And then in the evening, I will tongue scrape. So it's an ancient Ayurvedic practice. I use a stainless steel tongue scraper. You could use a copper one, but essentially that's removing the biofilm, food particle remnants, and potential pathogenic bacteria from the dorsum of the tongue. You don't need to overdo it. You don't need to do it aggressively. Be gentle. Be smart. Just use logic here. But I will tongue scrape, and I do find I feel better when I do that. My mouth feels cleaner, but I also taste my food better kind of the next day, just to get those food particles off your teeth. Because believe it or not, there's a lot there on a molecular level. And then I will usually water pick at night or floss. I do like to switch it up. I don't think everyone needs to be doing this. However, as we age, we all do tend to lose some bone around our teeth, very mild periodontal disease. Hopefully it's mild, not severe. But to water pick, it's just getting down into the sulcus, into the deeper areas between your teeth where different types of pathogens can leave. Floss won't completely do that. Floss is really removing the biofilm that's adhered adjacent to the tooth, sticking onto the tooth, but it's not getting down into that space. So I do like to water pick. I usually will add a little sprinkle of baking soda into my water pick, or I might floss because I kind of switch it up, and then I brush. And I will then take an oral probiotic usually at night too, before I go to bed. And that's my routine. I don't do any mouthwash. That's the other thing people get upset about too. They really want their mouthwash. We do know conventional mouthwashes, and I think we're moving more into ingredients, but there's a lot of concerns with the big brand mouthwashes out there because there's a lot of antimicrobials and strong alcohols and astringents in them that are really carpet bombing the mouth and damaging a lot of these beneficial bacteria, including the ones responsible for our nitric oxide levels. And so there are studies that have come out showing that patients who use really strong like chlorhexidine or even like Listerine, those really burning mouth rinses, they do tend to have a higher predisposition for heart disease or high blood pressure, likely due to that nitric oxide influence. And so, chlorhexidine, people still use it so much here in the United States, and in Europe, they really shun it because it's just too powerful. You just don't need something that strong. So you may find that your dentist finds that to be controversial, but I'd really caution being careful using that, especially long term, because again, we're wiping out the healthy bacteria too. So ingredients do really matter. I like patients to focus more on nourishing and boosting the good bacteria and a little bit less on kills 99.9% of germs. We just need, again, that mindset shift. Unless, of course, you do tests and you have some of these very virulent, nasty bacteria, as I did, F. nucleatum. And then you might want to bring out the big guns for a short period of time just to get your body back into balance again. And you can think of that almost like sometimes we do need antibiotics, for various issues in the body. We're very happy to have them if needed. I think they are very much overprescribed, but we're happy to have them if we need them. And then we work on rebuilding the healthy bacteria after we run a course of something like that.
How do you feel about the more natural mouthwashes? As you talk about brands like Listerine, there is that in-between brand that's at least assumed isn't as chemical laden and potent. It doesn't sound like you use one, but for people that are, what do you think?
Most of them that I've seen are very strong in essential oils. And so those can be some parents will use essential oils on their kids like an antimicrobial or antibiotic. I've seen oregano oil clear out an abscess next to a tooth. It's so strong. So I say again, take caution. There's like a toothpaste that's quite popular, especially among naturopaths. And I love the company, but it has filled with herbs and that are very strong and powerful, and patients are using this every day. And I caution against that, these strong essential oils and herbs, because the power of plants, they can be as powerful as some of our pharmaceuticals, So I don't really think people need to be rinsing. If you really, really want to rinse, I would say use water and baking soda and salt, and you'll save money, right? Or try to pick up coconut oil and just do it a few times a week. Now, unfortunately, some people will say, well, my mouth doesn't feel clean. I need that burn, that minty burn. When I hear someone say that, it's a couple things. I think you're either just kind of hooked, like you've created that habit, and try to break yourself of it. It's a lot like if you've ever switched your deodorant, you used to use Secret or Old Spice or whatever, and then you learned, oh gosh, there's some concerning ingredients in here, I'm going to switch to a more natural deodorant. There was a transition period, maybe you smelled yourself a lot and you just felt like you had to, your skin microbiome had to readjust. And it's the same with washing our hair. We're learning we're overwashing our hair, and a lot of our shampoos and things are stripping all these like really healthy oils in the skin microbiome. And so we're now being educated to wash our hair less and use agents that don't foam in our hair. It's the same with the mouth. So just give it time to relearn what a healthy, balanced microbiome can be. That doesn't mean your teeth are always squeaky clean. You actually want a thin biofilm on your teeth, because it can be protective. Like there are good bacteria that can create a biofilm. That's how they're exchanging minerals and communicating the saliva with the teeth, and they have immune cell function. So that whole like carpet bomb, 99.9% of germs killed, I think we know better now. It's just like how we over disinfect, we over bleach, we over hand sanitize, and now our kids have asthma and eczema and allergies. Like we really need to understand that microbes can be good. So I would say, so it's either that, it's either a habit mindset shift, or if you really feel like you have terrible breath, there's something else going on. either have uncontrolled periodontal disease or gum disease. Maybe you have tonsil stones. Sometimes it's like a sinus infection. Chronic sinus infection can lead to mouth odor too. So the mouthwash is just masking the issue. Like, we shouldn't have this really potent, damaging breath to the public, if you will. And so if you have that, we need to dig deeper. The strong Listerine's only masking that. It's not really correcting the issue.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.